Depression is a medical condition, a disease of the brain, where more days than not, over a 2-week period of time, someone feels down or with a low mood. They may feel sad. They aren't really enjoying the usual things that they do in life. They may have disturbances in sleep, with appetite. They may not be able to concentrate as well. They may have lost interest in their everyday things. Their energy level may be low. They may have a physical agitation or slowdown. And when you have enough of these things, you have what is called a depression. And in the worst case, when a depression is very severe, someone may not want to live. They may have suicidal ideation or thoughts of suicide.
Hi, Assalamualaikum. So I will explain about depression. Depression can oftentimes be hidden in a plain sight, making it difficult to identify. So understanding and recognizing the signs, symptoms, risks, and more is the first step in the recovery journey. But nowadays, people keep on claiming himself or herself depression, but actually there are not. So you guys should understand and know what is actually depression about. Depression is a mood state that can significantly impact an individual's entire life. Major depression is a condition that goes far beyond feeling sad or upset. Depression affects a person's moods, thoughts, feelings, behavior, and physical health. So severe depression can result in losing the ability to feel pleasure in formerly enjoyable activities and or social relationships. So come on guys, don't be so stressed. And current depression is higher than before. So I want to explain several causes and risks for depression, such as genetic, psychological factors, and environmental factors. So I choose these 3 factors because I think this is most popular and most hot topic for depression. Okay, so for genetic, depression has been found to run in families. People who have a first-degree relative who has depression are at greater risk for developing the disorder than those without a similar family history. However, many people who develop depression do not have a family history of the disorder. So research suggests that it's likely that there are multiple genes working together that are responsible for depression rather than a single gene. So next is psychological factor. Some people are born with a personality that includes a depressive way of thinking. They believe a positive event is related to others, while negative events are always their fault. Actually, this is really not good. And the last one is environmental factors. So there are many negative life events and major stresses associated with the onset of depression, including job loss, loss of loved one, trauma, problematic relationships, lack of confidence, and lack of a sufficient social network. And what are the signs and the symptoms? If you think you are a depression, please do come to any hospital to do checkup, because symptoms and signs of depression will vary based upon age, length of symptoms, and individual temperament. Common symptoms of depression can include mood symptoms, physical symptom, behavioral symptom, and also psychological symptom. So mood symptoms include depressed mood almost every day for long periods of time, sadness, loss of interest or enjoyment in practically all activities, sense of worthless or guilt with no reason, and loss of interest in sexual activities or desire. First, physical symptom. There are a lack of energy, increase or decrease in appetite, increase or decrease in sleep, somatic complaints and particular pain, and feeling emotionally numb. And the next one is behavioral symptom. Behavioral symptoms such as social withdrawal, slowed speech or poverty of speech, loss of efficiency completing tasks. And the last one is psychological symptom. Hopelessness, loss of self-esteem, trouble making decisions, lack of motivation, and concentration and memory problems. So this is very dangerous. And the last one is effect of the depression. Depression can lead to significant impairment in an individual's ability to enjoy life. So the effect of depression can range from minor to annoyance to death. So with proper interventions, depression can be treated and managed throughout their lifetime. The most common effects of depression can include poor coping skills, pain, especially headache and stomach pain, sexual dysfunction, attempts to self-medicate with drugs or alcohol, anxiety, decreased immune system functioning, family and marital problems, rejection at school or work if you are a student or a working people, social isolation, self-mutilation, suicide, premature death in the medical conditions. So that's all for today, and thank you for watching.